Ooh, I can't read this today. I got it.
Okay.
Sorry.
Greetings. Right on time. We're just waiting to find out if the stream is up.
Terry Lorenz
leaving
says we are
Thursday.
live.
Hey, okay.
I have my stuff.
We've got microphones and all of that near us.
I can't do that.
We
Can't do
are
that right now.
live.
It's okay.
Can they hear us? I guess we're live.
Excuse me.
I'm
There's one
hoping-
over there.
I guess I
There's
just,
one back there.
On the wall?
trust
There's a
nothing.
full-size one. In the stand.
Oh, yeah. I
Yeah,
thought
oh,
somebody
no,
said they didn't see it.
flag there for sure. Okay, well, I've got 6 o'clock on the dot, so I'm going to call our meeting to order. Please join us in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right. Need a motion to approve the agenda.
So moved.
Do I have a second?
Second.
All those in favor?
Aye.
Aye. Okay, this is going to be a short one. Well,
She
who
says,
knows?
hopefully.
Let me rephrase that.
She said sure, at the board meeting.
For, just to clarify, this whole meeting is not about all of R2L. I kept getting emails throughout the week about how this is supposed to be about returning to learning plan. That's not what this is. This is just about a resolution to deal with COVID-19 issues. Aha, even closer. So with that said, we've all been looking at a version of the MSBA based resolution, their proposed resolution that boards throughout the state have been, versions of which the boards throughout the state have been considering and approving, or in some cases not approving. We've looked at ways that it has been adapted for our specific district with recommendations from Dr. Mayer. That's all the preface I think I really need to give about it, and I'm going to open it up for discussion. And at any point, if anybody feels the need to make a motion to accept it, then please just go right ahead.
Well, everybody's looking at me, so I guess I'll talk first.
Oh, I thought
You were going to.
Did I make a little noise?
Yeah.
The only thing that I wanted to do is, one of the bullet points that was in the MSBA policy and that was sent out to us kind of as the mirrored policy that we were looking at, said that staff would use 2 personal sick days prior to going to the 10 COVID days, which were the federal law prior to December 31st, and basically the extension of the federal law that we're doing through the end of the fiscal year. I believe that we should not use those 2 personal days for staff first, because that wasn't what we initially did, and I believe that we should just stick with that area. Otherwise, we had asked some questions about finances that Dr. Mayer had sent us. Just to let you all know, we roughly spent, I believe, around $41,000 was the report from the beginning of school year till the end of the 2020 year. And the projection, of course, would be the latter 6 months we would use something similar. Of course, those are projections. That was where we were money-wise. So looking at probably another $50,000 to $60,000 in cost, even if we inflate that by probably another 30% or so.
I have some questions about that. When I asked those questions, we've spent $41,000, and we've only, out of 324 employees, we've only paid 13 to 15 employees. So that leaves 305 or so employees to get COVID or get the COVID pay. That will well exceed $50,000 if all 300 of those people get it. Our numbers would show that it's likely that they would. So I would just ask, what's a real number if everybody really gets it? Because 41,000 for 15 people, when you still have 305 out there, that is a large number.
A lot of money.
So it's just well over 50,000 that we've projected, which I understand why you did. I understand why we've projected 50,000, because that's what we used previous. But we're in flu season, and we've got people that have symptoms of things but are not testing positive.
But
And
for
so-
this, they'd have to test positive.
I think it said quarantine.
It does not. They do not have to test
Quarantine.
positive. They have to,
Be quarantined in isolation related to COVID, to the COVID virus, which could have been someone being in contact or, contacted by our local or state, someone in the health department to be able to quarantine them.
I think the reason that the
Dr. Mayor,
number
be sure to
is-
pull that microphone close.
Okay. I think the reason that the number is lower than would be expected is because hardly anyone took the full. And it says how many used the full 2 weeks, isn't that?
13 to 15.
Right. But only 13 to 15 used the full 2 weeks. Most people only use 3 or 4 days.
Okay.
So
Okay.
they're more than the 13 to 15 that
Okay.
it says here.
And I
Yeah.
also overestimated it because if you think about it, we also weren't in school for 6 weeks of that time as well.
We still had people that were quarantined and things for COVID.
Yes, we still did, but by being in seat possibly more, we have a higher percentage of possibly having transmissions.
Maybe, my
So-
point is I think the 50,000 is a low, I think the 50,000 is a very low ball, and I appreciate why we did that. I just wonder if we're being very, this is not an argument for or against this is an argument for our budget, and working very hard to maintain that in my eyes. And so I just want us to be aware that I think 50,000 could be very low.
I think that's
And to
hints,
also be clear, the 41,000 was also paid back out of CARES money so far,
Yeah, but
No, it wasn't.
wasn't it?
No,
No.
Oh, it was
No,
not?
it
I
was
thought
not.
we were able
That's
to
what we
reimburse
spent.
that. That was not?
No, we got zero reimbursement for that.
right.
Oh,
I was under that impression too, Brian.
oh. Well, I thought that would come back into that. I'm sorry. Excuse me for
Well,
misspeaking.
the law is presented as organizations will be reimbursed through tax credits.
Yeah.
Schools don't pay
Schools don't pay
taxes.
taxes. Yes, ma'am.
So we can't be reimbursed
Gotcha.
for something that we didn't pay.
I'm not very good at math. I'm trying to figure out if we can quarantine 305 people, we'd be broke. We
Yeah.
couldn't even make that payroll.
Well,
Correct.
how likely
That's what I'm
That's
is
where
asking.
you're
that?
going.
It's exactly what I'm asking. I just want to make sure that, and that's what my questions were asking.
If you did 300 people at what averaged out to be $2,733, it would be $800,000 or $820,000 roughly.
So where do we draw the line?
Well, I think that's why Section 14 becomes important. Amendment or termination. The board reserves the right to amend or terminate COVID leave or any part of this resolution at any time. The administrative staff will provide regular information to the board regarding the use of COVID leave. The board may reconsider or terminate COVID leave if Congress extends the federal EPSL or otherwise requires employers to provide additional paid leave to employees. The state requires districts to extend or additional leave to it. But we can, for any reason, at any time, underline, amend or terminate this. If it comes to be something that we just can't afford, I think it's enough to say we tried in good faith to make it work. We are going broke trying to cover it. But at least we tried.
Are you comfortable saying, are you comfortable when you hit a threshold of saying like, well, guys, we can't do this anymore?
I think we probably should think about predetermining what the
Yes.
threshold should be.
Yes.
I would
would
like
be
to
your
see it on the board
If we
agenda.
pay- If we have to pay up to 200,000, that will be the line where we stop, or 100,000, or, I can do some more figuring. I'm very optimistic since the vaccine is here. I'm hoping that will curb it possibly, but I think it would be wise to say up front, we cannot spend over 100,000 or 150, whatever we decide.
What did you say about the board agenda?
I would like to see it on the board agenda even this month and next month, just to make sure that, and if something crazy comes in, some high numbers, if we need to get an email of notification, but just an update as we go along, depending on, it may change, the government may, renew it. We don't know what's going to happen.
Wouldn't that be
Christy, when you
nice?
say it, you want to see it on the board agenda, what is
The
it?
update, I'm sorry.
She-
The
she wants
update
to
of the
see a
numbers in the
dollar-
budget,
a
yes.
dollar
She's
amount.
wanting to
That's what
see
she's
like the
saying.
running total.
Yes.
Right.
I didn't know if she meant she wanted us to redo this again next
No,
time.
no,
I was like, okay.
I'm sorry, Aaron. Clarification, we're talking about budget money and the threshold. I'd like an update on that.
And I don't know if it would matter if the government
No.
extended it or not, because we can't get reimbursed for it.
It depends on how we do it, but it doesn't seem likely, does it? I think another thing to emphasize is that the buildings had been doing, I think as we've all noted, the buildings have been doing really well with implementing protective measures. And that's commendable. That's why we can even have a really solid conversation about coming back into in-seat learning. So I guess I'm looking on that bright side. You
Just to
know?
also, Mindy is also here from the CTA. The CTA, she did send me a recommendation as well, which they were asking for the support of the 10-day rule, just to say that out loud for everyone, so.
The one that you proposed to drop the 2 days and over 10 days?
No, they didn't, she actually didn't even ask for the 2 days. She wasn't aware of that probably by looking at the MSBA policy or not looking
Okay.
at it. The 2-day drop was just mine because that was something that wasn't required in the original law.
Yeah.
And I thought it was something that was almost punitive if we came back to it at this juncture. Now, dollars will count at some point in
Right.
time. So, but we'll have to look at those things as they come going into the future.
It does give us some more room to move, you know, going forward. If it seems like affordability is becoming burdensome to the district, then maybe we can split things. I'm not gonna have side conversations though, hold on.
My question is she runs our budget. Is she more comfortable giving us a dollar amount tonight? Or is she more comfortable being able to run and manipulate her budget and then giving us a number after tonight?
Hence why I thought that's what Kirsty was asking
And
for.
and Christie's saying she would like to have a running total to update us to this number.
Right.
I don't know that, as a budgeter, I don't know that it's fair for us to say, oh, Dr. Mayor, what's your number? Without her being able to go back and scour it.
Right.
And sift it. That would I just was asking that before
I could have a number for you.
tomorrow.
Tomorrow.
Yeah, okay.
Could we separate it as a separate budget item for you, or would that be more difficult?
Let's,
Well, I'm going
still part
to,
of payroll.
I'm going to offer amendments to the budget this month.
Okay.
So I can put that on the
What would
budget.
the-
I'm already going to put the COVID leave pay that we've made on the, so I just don't, I'm going to talk to some other superintendents, see how they are doing. I feel, maybe I'm just being very naive and optimistic, but I feel with the vaccine coming that I'm not sure that we have to worry about, well, $100,000 is a lot of money.
Yeah.
But I'm not sure that we have to necessarily worry about going much over that. If you want my opinion for a dollar amount right now, I don't want to say that and put that in concrete. But
sure.
Right.
okay, and Ed's got something
I
too.
just got a request for you, Dr. Mayor, just to keep us really updated. I mean, you can forecast, you can see what the numbers are
Right.
doing, and there's no one in the district knows it better than you and Dawn.
Right.
So if you see that number, you could
I will.
project it, maybe this date, hey, guys.
Right.
I'd just like a heads up, not, we come in here on a board meeting, hey, we got to
Yep.
do this. We need an update on that as it's going. If you see it climbing, I just request that you let us know that.
I do
so-
think that we should absolutely, and communicate this to the district employees, say we can't go over whatever number it is. When we reach that ceiling, that's when we have to stop.
Yes, I agree.
But I'll get that to you tomorrow.
I also want to commend the district employees. I've asked about some numbers or looked at some numbers today of people that have reached out for the vaccination just on the first day. A third of our district has already said that they're willing to and signed up to take the vaccine when it becomes available. And that is a very high percentage, I can let you know, across businesses, period, or entities, public entities that have been available or had the vaccine made available to their businesses to date.
We want to commend them for being as careful as they can be about, maintaining the usual protocols, social distancing, wearing masks, washing hands, whether you're in the school or out of the school.
And I was asked by an employee, if we all get our vaccines, then can we stop wearing masks? Well, the answer to that is no. I think it will probably take from what I've read, the experts are saying it will be 70 to 80% of the population will have to be vaccinated by the time we can do that.
Yeah.
And that's not going to happen anytime soon. So the answer to that is yes, we'll wear a mask, we'll social distance, we'll do all the things that we're doing.
Yeah.
So another question that I have is on and I don't know what the district has required outside of the employee has to fill out a form to request COVID leave time. In the general Family Medical Leave Act, a physician or a medical professional has to sign that paperwork and release them for that, and basically approve them for FMLA, which is the same as the FFCRA. Is there something, who is the deciding person? Who is the deciding entity? Who is the, I don't know, the COVID god that decides if somebody has the appropriate things to be off versus not?
I thought it listed in there that it was superintendent discretion.
Well, right now, it has been, up to this point, it has been, I take you on your word. After, if you pass this resolution, then documentation from a medical personnel,
Did I miss
some
that?
medical
Yeah,
personnel.
that's
is
listed.
Okay, I missed
required.
that. Okay, okay, okay.
Section
And it says
10.
may be, so the clause is may be, not will be.
So, but then we probably need to say, will, I thought it said will be.
Yeah, we need to make that-
So on the form that the employees turn in then, there should be a signature line for a medical official also.
And so is that someone of their choosing? Should be?
Yeah. I
Okay,
think
perfect.
so.
That's why I just wanted it to be, I wanted it to be the employee's physician and not someone from the district, so we're not liable
Oh,
for any of that.
Right.
So if somebody moves and we approve this, then section 10 under documentation would read, employees taking COVID leave not may but will be required to provide. Is that the change that I'm hearing suggested?
On the fourth bullet, on the the ones that I had sent at the first, it says the district will require documentation of medical attention from a physician
Yeah.
or healthcare official.
Oh, okay, so
So
then,
it may conflict in there, and I'll clean it up.
let's
Okay.
clean it up now. We're just gonna take care of this business right now.
where
So
do
that's
you see
point
that?
number.
Number 10
That's the bullet
on page
point. The
2.
district will require documentation of medical attention from a physician or healthcare official for COVID leave. Are we suggesting that that language then replace number 10 documentation? Let me read what's.
Where did you just read from?
I'm just going to say, I'm going to read first from the MSBA resolution, the piece of paper that I've got here in my hand, and then I'm going to compare that with the fourth bullet point that Dr. Mayers got from her email. Okay, so the MSBA resolution reads as follows, under section 10 documentation. Employees taking COVID leave, currently it says may be required to provide documentation verifying that the absence is due to a qualifying COVID-19, I'm going to
Issue, it
say
should say,
diagnosis
yeah.
or something? Okay, as determined appropriate by the superintendent or designee. Maybe the lawyers understand that kind of writing. Okay. And then the revised version, as proposed by Dr. Mayer, reads as follows. The district will require documentation of medical attention from a physician or healthcare official for COVID leave. The question before you is, how do you want section 10 to read?
The word will.
Will, okay, so instead of may, will.
I
if
think-
we're going to use the number 10 as it's listed, I think we need to put in the medical professional part of it as well that was in Dr. Mayer's suggestion as well.
Yep,
I actually think you should,
There's an easy,
I think you should use the one in the bullet, the fourth bullet, because
I
here it
agree.
says determined appropriate by the superintendent or designee. That means that I would have to say, okay, your doctor is okay, but yours isn't. I don't
So
want to do that.
remove 10 and
So-
add your bullet point.
So the bullet point
Yeah,
would
I agree
cover
with that.
that.
a simple solution is put the bullet point in front of the rest,
Right.
change leave may to will, and then COVID-19 issue.
whoa, I got lost on that one. Will you read that out, Harry?
The district will require documentation of medical attention from a physician or healthcare official for COVID leave. Employees taking COVID leave will be required to provide documentation verifying that the absence is due to a qualifying COVID-19 issue, as determined, and you
Okay.
can, may or may not, as appropriately by the superintendent or delegate.
I would just say determine appropriate and leave the superintendent off the
Yeah,
back end of
because
that.
if a medical professional signs it, then we're off the hook.
Right.
So we'll just leave it at COVID-19 issue.
Yeah.
Yeah.
Well, if we're worrying about the may and the will,
Right.
Yeah,
I
it's
think
gotta
we
be
just put a
will. It's
period
gotta be
after
will.
appropriate, and
But
get rid of the
also-
last 3 words.
Oh, we do want the as determined appropriate? Then
Oh,
who's
I thought
determining
you
the
wanted the period
appropriateness?
after issue.
Yeah, let's put that period after issue.
Absence is due to a qualifying COVID-19 issue.
Boom.
I think that would work.
So if we're gonna leave the next one in, under communication as well,
Right.
then I think we take may out and we put will in there as
Right.
well.
Right. The same with good faith, too.
Well,
It's in there.
I would leave it, Brian, because once they're on, the way it's set up, when they're on there, we want to, as an administrator, I would like to know, are you going to be back in 2 days, 3 days, 4 days, 5 days?
That's why I'm saying the district will, instead of saying
Will
may.
require.
Oh, yeah.
May
okay,
require
I'm
an
with-
employee, yes. So those people that are using 4 days instead of the whole 10, and they're looking to
That way,
come back,
that
then
way
we're
the
aware.
building administrator can plan, well, John will be back in 4 days, and
Right.
so-and-so won't be back for 2 weeks.
Okay, so let me read this out. For number 10, I've got, the district will require documentation of medical attention from a physician or healthcare official for COVID leave. Employees taking COVID leave will be required to provide documentation verifying that the absence is due to a qualifying COVID-19 issue.
Isn't that just saying the same thing twice?
Kind of.
It is,
Why don't we just use the bullet point?
there was a reason I thought it,
My reasoning was is that this came from MSBA pretty much, and there was a reason that they put that extra line in there, I would think, from some lawyer, so I didn't want to play with it. But
Yeah.
It would be, if I were at my copy editing desk, Matt, it would take me about like 30 seconds to clean this up and get it over with. This will be fine, so I'm gonna roll with it. Yeah, but you're right.
So on number 9 then, do we want to put, it will expire June 30th, 2021? Do we want to put in there or when
sooner
ceiling
upon-
met as determined?
I mean, so we can't, sure. If that's a fine redundancy to add. I know that sometimes contracts, you know that too. Sometimes contracts do have a termination clause that, extends throughout the document, over and against any other date. But it certainly doesn't harm us to have some redundancy. So what language and where? Now, wait a second. Ed, you also had an idea. What about, we might want to apply this to summer school?
I believe that's where the flexibility comes, where we make sure that we have that, where we can extend or stop at any time. We could choose to extend it as well past the June 30th date as needed. If we,
On the expiration clause, though, does say will not apply to absences from duties related to summer school. On number 9, expiration,
Will not, yeah.
will
number
not
9.
apply to absences from duties related to summer
Oh.
school. So perhaps we could just strike the and will not apply all the way through to summer school and instead add in Matt's
Is
comment.
that a
Now, this is just a question.
different rate of pay for summer school?
It's under a different deal, budget.
Yeah, it is.
So that's my
but-
question. If so we're gonna pay a higher rate at
I
that
guess we
point in
can,
time.
we can revisit it then,
It's-
if that's too
it's a
complicated.
It's a daily rate, and so if they're working in summer school for a daily rate, it will be that daily rate.
Well, then let's revisit that when we come closer to summer school. Now, Matt, what was your recommendation then?
I thought we could put in there expire on June 30th, 2021 or
Or earlier?
Ceiling is met or
when
whatever.
budget ceiling is met as determined.
Or amended by the board.
Or, yeah, I think just making reference to,
the first bullet point that Dr. Mayer submitted is what I was thinking that we would put into expiration. I'm sorry. I was plugging these in when I was looking over it,
oh, I see.
because the one that she had did have that, it didn't mention summer school or anything else. The MPS Board of Education will extend employees regular daily pay for 10 COVID-related sick and quarantine days, COVID leave from January 1, 2021 to June 30th, 2021.
Yeah, and what Matt's saying is, shouldn't we add in something there about like, unless the board terminates this
Right.
prior to that date? And
Amends or terminates.
amends or terminates, yeah.
Which we have that on 14, stating that we can do that at any time.
Well, and that's my point, is that we've got that in that
In there.
termination clause anyway, so,
So if we
I
were,
just meant for the budget ceiling, because if we're gonna have that in there, I mean, because
If we
it's
hit that
gonna,
number
it's gonna
first.
happen. If we hit that number and we stop it, they're gonna say, well, it's not in there.
no, but it is, because that's what for any reason means, or
Well-
for any part of this resolution at any time. So, my only regret is that we didn't think of this budget ceiling as an idea prior to this time, because we could have had Dr. Mayer working on having that budget ceiling.
I started it. I just
No,
didn't have
yeah.
enough time for all my questions.
that's
I
it.
just-
Yeah.
That's
No,
where
no.
I was going with this. is I just-
It's a genuine, like, oh, I wish we, like, if only you had, like, all your, you always have the good ideas
have
after
enough
you
time.
leave,
I don't
right?
have enough
You know?
time.
Yeah.
So,
So I've been thinking, like, I've got some notes jotted down to myself about, like, we don't need a dollar amount in here. Can we just clarify what the budget ceiling would be at the next board meeting, right? Like, have this as a line item on the agenda so that we don't have to, we could even amend this.
Can we just add it as an appendix?
Yeah.
Or you can amend it.
You can
or
always
can
amend
amend
You
with
can
it.
adopt it
Amend it.
with the
But
budget
it doesn't even
amendment.
necessarily have to be in there, like Aaron said, it can be when we hit the threshold that we've decided as a board if we can't live with this or not.
Right.
And as she gives us direction on that at the next board meeting on what we can really afford, then I think that's where we set our ceiling.
Are we truly working on two different documents, or are we going to concentrate on this document?
Well,
and
let's
just
come
use
back-
this and incorporate it into here?
Let's come back to that because
Because
we.
otherwise, we'll be here all night.
No, let's come back to that because we still need to address the question of whether anytime we bring up, and it's a legit question, anytime we bring up a deadline in either document, we need to refer back to section 14. If we had just like quick and easy language, what was it that you said, Ed? Until and unless the board amends or terminates
Right.
this resolution. Okay,
14 covers it.
I know,
14
I
is
know,
fine.
I know. Are we all in agreement that 14 applies to the entire resolution?
If we go that way, then yeah, we
Yeah.
have to change it.
Then, okay.
We are in agreement now. If you want to have a lawyer look over it and make sure that
The lawyers
they are in
wrote it up.
agreement.
MSBA is stuck to the brim with nothing but lawyers.
We have enough
honestly,
lawyers.
I'd like to have the expiration a lot sooner and then just do an extension on, amend this and do an extension on the agreement later.
Well, we have that, 14 is written, so we do have that option.
I mean, right, yeah, so if we want to amend or
We can amend
terminate
or
it
terminate
anytime,
at any
we
point.
certainly can.
Just so it expires and then you renew it.
Okay, well, what's your?
So I was thinking
expiration
more
date?
like March, then you renew it at that board meeting if you need to, depending on what is.
Anyone in favor of that?
Well, I've never done a resolution before, so I don't know how that all works.
Resolutions are just as easily made as unmade.
Well, and my thought process would be a little bit longer than Christie's. My thought process would be when this contract year ends. So when the contract is done, then in May, then this resolution should be complete. If we want to continue into the next
The summer
contract time, then we might have a new resolution. That would
But
be
we
my
do
only.
have teachers who are on 12 months.
Now, you do
Right.
have 12 months.
I mean, you
time.
do have that, so, I mean, then, that's what I was gonna say, then do you go to the last day of this school year? I don't know what's right.
Right.
And so that's why they just went to,
June 30,
just to make it,
make sure there was. an
everyone
end date.
who's in that year gets covered, to the extent that they're going to get covered by this. Okay, now back to Harry's question. Harry, what I'm dealing with is the MSBA document that's in front of me. I do not, as much as I might try sometimes, I cannot read Dr. Mayer's mind. And so, when I look at her bullet points, I am not sure about where she would have them go. And they might apply in multiple places too, right? So, as they might apply throughout,
Well,
then they should
All right,
be.
so then if nobody's objected, then Brian's thing is mute because we're not going to deal with that, because that's her document, and our document does not have the 2 days in it.
Yes, it does.
And
That's in number 7 on the MSBA, but not on hers.
So
Oh,
let's,
agreed. Okay.
so let's jump over
stand
to
corrected.
point 7. Are we in agreement about taking out the 2 days, or do you want to leave them in? General consensus before we,
Yeah.
leaving them in, taking them out?
I think we should take them out.
I'm fine
Take it
with,
out. I was gonna say leave it in.
Okay.
Why do you want to take it out, Brian?
Because that wasn't what was required of us initially in the
Yeah.
beginning. So then, in my mind, whenever we do it, now, if this is a good faith to show that we are doing an ethical and moral thing to do to help with our employees and to cover them, then I feel that putting 2 sick days in at this point, then that is like, hey, we're gonna split it with you a little bit, and you're gonna give us a little bit of your time, and we're gonna still use some of our time. Instead of just saying, this is what we've done for the first 6 months of the year, we're gonna do the same thing for the next 6 months of the year.
I'll accept that.
And I
but we
don't-
as a school district didn't do the first set.
No, we did not, but that was just the laws that we followed and the laws that we're basically extending.
Well, it's in there at the end that they have the option of using other accumulated paid leave prior to using COVID pay, so let that be their choice. If they're,
Right.
So Matt, yeah, I was just thinking about that. I was like, well, how much of this would we line through? And it would be everything up to, right? Employees have the option of using other accumulated paid leave.
Yeah,
Everyone on board with that or no?
I mean, everything else can pretty much just go.
Yep, so we're striking through everything in section 7 up to employees have the option of using other accumulated paid leave. Dr. Mayor, will that create any oddities?
What did you strike out?
We're looking at number 7.
Yes.
And striking through everything prior to the final
Oh,
sentence.
employees have the option, okay.
Uh-huh.
No, I don't think that will,
Create any
I don't think that will
weirdnesses.
make any difference, because you are going to set a predetermined ceiling,
Yeah,
so,
And if they decide to fund it all of a sudden in the next,
then even.
Well, they didn't fund it last time, so.
Yeah,
I don't
not
foresee
that way.
Yeah, I
so
don't
who
foresee.
knows?
I do have a question, and this is just because I don't know truly how this is going to play out. If an employee is off, and I'm just being devil's advocate, if an employee is off work and says they have symptoms, and the physician says, go get tested, and then I'll approve you to be off for COVID leave or not. If that's the case, then our employees will not have a benefit. They'll have to choose to use possibly 2 days or 3 days of leave prior to that physician writing
well, if the
signing their
physician
statement.
says you have symptoms, that's enough. The symptoms, I mean, the way it was written before, the symptoms is enough.
Okay,
It
I'm just
doesn't have
making,
to-
I'm just
I
making
don't
sure, because
agree
I
with
don't want
that.
to.
I don't agree with just a symptom. They need to go
Me
take a
either.
test.
Me either. I don't agree with the
That's fine.
symptom because you can, I mean, there's a lot of things going around right now that
I
are
mean, I
not.
had a runny nose, and that's a symptom, and I did not have COVID.
Well, but the
So-
where was that at? Because that's
It's
what you
been
guys just
amended.
corrected me about.
There was
Wasn't it?
one point that said that the employee was displaying symptoms and preparing to, or had been directed to test or something.
1C says, is experiencing symptoms of COVID-19 and is seeking a diagnosis from a healthcare provider.
Yeah. so
I'm
that's a-
I'm just saying, as a,
Well, that's a both and, thank goodness. You got to have this and that.
I'm just concerned that if a physician is getting it and says, well, I don't know that you have COVID yet, I can't put you off for that necessarily right now, but they might start the dates as of the test rather than 4 days earlier when the symptoms. I'm playing devil's advocate because I want to protect the employees. If we have this 2 days in here, I want to make sure that they understand that if they need time, they can use it. My other statement was going to be this. And this is totally on the other side of this. If an employee loses enough time, if they're off work without pay for some reason, they run out of days or whatever, our government has put in an unemployment insurance of $300 extra a week for these people to use. So if the COVID pay runs out, then they have that benefit still that we should encourage them to use if they have to protect them. Does that make sense? So if somebody doesn't, let's say somebody's already had to use sick time this year for a kiddo. And so, let's say their COVID days run out because they've had a sick kid or whatever. I hope that the majority of these people have been able to work at home and cover their classrooms, because we know kids learn best from their teachers, right? But my concern is if somebody gets in a crisis, or we get in a crisis and they're out of days, this is done, and they're out of days, they still can use that unemployment benefit and receive that extra $300 a week through our government. So we just need to encourage them so they know of all the benefits that are available.
If they're, but we'd have to terminate them.
Nope,
No?
they're off without pay,
Whoa.
off
But they're
without
still,
pay.
but they would still be on contract.
Absolutely, but they're off without pay. There's no pay for that contract because they have no contracted paid days left.
I'm not an HR expert. I
So
don't
that's
know.
just something that we need to encourage them. I've spent a lot of time studying that because we've got to protect people so they can continue to pay their bills and live. So when this goes away, if somebody's still sick, and some might be, that's
So
something to think about.
Our salaries are divided into 12-month increments. So they would be being paid ahead of time, essentially. So would that keep them from being eligible?
I don't think so. It's the days that they miss. If they can prove that they were docked pay for certain days, then it calculates that into their,
Oh, it's the docked, okay. That's.
so
fix
docked
it in.
paid days will count as an unemployed day.
I'll check with the lawyer
Yep.
on that.
Okay.
So, and that's as I understand it, and I've read a lot about that. And the other thing that came to mind is the other 2 weeks that follow. Did you have anybody that used 2 weeks and then needed 2 more?
You mean they're taking them now?
You mean of the 15 employees that use roughly their entire 10 days, is there anybody that went over the 10, is what she's saying?
I don't know that.
And the only reason I asked that is because I was curious if we follow the law, because it gives 2/3, it gives 2 more weeks of pay at 2/3 of their pay. So 2 full weeks and then 2 more weeks of 2/3. And so I was just curious if we'd done that, if we'd had to do that.
No, we have not.
Okay, perfect. That won't change our budget amount any. Sorry, I'm just finishing up my questions.
And that's not included in what we're proposing?
It's
at all?
not, but if we'd already done that for someone, I
Right.
wanted to make sure we were fair, if that's what we're worried about.
Different law.
Okay, were there any other threads that I dropped that we haven't covered?
See, saw you pointed.
Yeah, I was trying to, right before Ellen went on the HR, there was something you said that we did not clear up, and I cannot remember.
Was it the 2 days on number 7?
We've struck through that, I think,
I
all
was
the
gonna
way
say,
up
it sounded
to
like we did, but that's where we were prior.
the, on, like, for the expiration, I have jotted in, after June 30th, 2021, I've written, or until the board amends or terminates this resolution. How does that square? Do you guys like how that sounds?
I got a question on
Again, that's on number 9. Or until the board amends or terminates this resolution. There you have it. Yes, Ed?
on number 12, the good faith. Says if the district becomes aware that an employee is not following district rules such as wearing masks, social distancing, sanitizing, or precautionary measures while at work, the employee is violating quarantine or isolation orders or recommendations, or is violating local, state, federal health orders, then superintendent or designee, I think it should say will, because we're doing our part to help them out. They need to do their part. There need to be some accountability. So if we're giving them pay for this, then they should at least be home quarantined, being what they're supposed to be doing. And I think if you take the may out of there, that gives it a little bit more concrete. In other words, I know if I'm an employee and I violate this policy by, I'm supposed to be quarantined and I go shopping or I do whatever, and I get caught, that takes it away from the superintendent, because if he says, it's putting the weight on her shoulders to make a determination. He said, she said, if you have proof at it and you know it, it should be will. I mean,
This is only at school, though. This is only while they're at work.
Right,
What they
I
do
got you.
outside is not anything.
Right, but we need to take that off the superintendent's shoulders, you know, because.
And not make it a discretionary thing, but make it a,
Right.
you will do this, yeah.
And I appreciate that, and I think that it would improve that statement if we said at the very beginning, if the district determines by evidence that
Yes.
an employee
Yeah,
not
that's
Thank
just
you.
becomes
I was-
aware, because with all the rumors that go around, we
Yeah,
become
well,
aware of a lot
You'll
of
get a
things
phone
that
call
aren't
tomorrow,
true.
probably.
Right?
She's
No?
done favors.
I agree
or
that you have
he's
to
done
have-
favors. Yeah, I got it.
So Dr. Mayor, what you have in mind is if the district determines by evidence that an employee is not following, and then et cetera,
Right.
would you maintain the use of may deny, or would you use will deny? I hear the MSBA lawyers in my head saying that there may be some situations in which it would be better to use some discretion, and this would compel you to, in
Well,
all
still have the
cases,
option.
do this.
I think if it's determined by evidence,
Then
then,
that makes it
I
easy
mean,
to
that
say
makes
the
it
will.
protected, but without that, without the evidence, you really are walking on thin
Well,
ice
I
there.
just don't want them to think that you're playing favors with this person. This person,
Yes, I
you'll
want to
get
take
that.
myself out of it.
And you've got that before,
Yeah.
so that just takes that off the
And
table. I
And
would
even
think.
using the word may still means that we hold everybody at the same line, you know, as well. But I'm fine with will.
Okay.
I think May makes it wishy-washy.
May's an option.
I
May
think-
creates an
I
option.
think
I
May,
think will also leaves us open for
But they-
retaliatory acts by other people who have an axe to grind, possibly with other people who are tracing them around, watching them go into the post office or different things,
well,
so.
again, it needs to be clear that it's while at work.
At work. And the only time that it
This
would
is-
go outside of work, well, it does. The only time it applies outside of work is that the employee is violating that the employee is violating quarantine or isolation orders or recommendations. Now, that would be for like the state or the county. And so that's just generally speaking.
I'm with you, Brian.
Yeah,
But
if you're
just not-
quarantined, you can't be at Walmart,
Right.
But you can take a walk.
as long as you don't talk to anybody else.
No, the host on the plate, take your butt to the park.
Okay, so the way I've got this worded now for number 12 is, if the district determines by evidence that an employee is not following district rules such as wearing masks or distancing, sanitizing, or other precautionary measures while at work, that the employee is violating quarantine or isolation orders or recommendations, or is violating, it should be or that the employee, or is violating local, state, or federal health orders, the superintendent or designee will deny the use of COVID leave, and the employee will be required to use his or her applicable accumulated leave and, or take unpaid leave. And then there's the final sentence as well.
I like it.
Okay?
I can live with that.
All right.
Brian?
Same.
All right.
I make a motion that we accept the document as amended, or is this an action item or not? Yes,
This
it
is an action item.
I make a motion that we accept the
Resolution
the
now?
resolution as amended through the meeting pending the written revisions to be set and reviewed one more time by the
Yeah,
board.
yeah, thank you. Want to see it one
Second
more
motion.
time.
Got a second? All those in favor?
Aye.
Any opposed? All right.
So we're gonna have her bring us a number to put in this before the next time?
Yeah,
No.
what I recommend, okay, so
Right?
what I'm recommending is, Dr. Mayor, please circulate to the board at your earliest convenience, the ceiling that you would propose. We can add this as an agenda item at the next board meeting. And we can, if we like, we can vote to add that budget ceiling into this resolution, or
It doesn't have to be.
we can just
Okay,
say, hey,
misunderstood.
hear ye, this is the budget ceiling for this.
Okay.
Okay?
And that budget amendment will be on the amendments that I give for the total budget,
That'll
and you
also be
will vote to approve that.
And so voila.
Right.
Okay.
I make a motion that we move from open session.
I can't, I don't know who got it first. I think it was actually Ed, so I'm going to do a second.
I will second it.
All those in favor?
Aye.
Any opposed? Have a good night, folks.
Awesome.
Thank you all.
Pinch you.
Would you like for me to do my
45
best?
minutes.
Oh, 45 minutes, it's a
Would you like me to do my
record.
best to type up what I've got?
It's a record.
got that.
Okay, I just was thinking,
Okay. I mean, I guess I can just
There's
hand
a
you what I've
record.
got written down, too. Yeah, sure. I don't think anything,
Aaron, let's get
Yes.
the TV shut off.
Yes.
oh,
No, and I appreciate it.